right, so let's delve a little bit more in depth into the interviews. So interviews are usually one of two types. They're either traditional or the MMI, which is the multiple mini interview. Some schools do a combination of these, but most of the time schools fall into one of these two categories. So as I previously mentioned in an earlier video, you'll still have that normal traditional interview day where you're getting tours and talking to students and deans and things like that. But then the actual interviews themselves differ substantially. So let's talk about that. So for the traditional interview, again, this is traditional, so this is what most schools have been doing for a really long time. This is a one-on-one interview. So it's really you sitting down with either a faculty member or a student and talking about yourself and answering different questions they may pose to you. This is very common. Sometimes it could be 2-on-1, even 3-on-1, or it could be a group interview, but most commonly it's the one-on-one type interview where you're just sitting down and talking to somebody. There's a ton of common questions that come up here, and we'll be working on producing some examples of these, but just to kind of throw them out there to get you thinking. Some of the most common questions you can expect to encounter are, why do you want to be a doctor? Why do you want to come to this school? What are your strengths and weaknesses? Where do you see yourself in 10 years? How could you change healthcare? Very common questions like this you'll see kind of almost at every traditional interview. So it's important that you prepare for this. Obviously, what you're going to want to do is prepare with traditional one-on-one type interviews. Get some interview prep from the med school coach advisors and have them sit down and ask you those questions and then practice going through and delivering your answer. You want to make sure that during the interview day, you're as comfortable as possible. The real interview, you're going to be nervous. Absolutely. If you're not nervous, then that's just strange. Most people are going to be nervous, but if you practice enough, those nerves will at least calm down and you'll find yourself a little bit more accustomed to this setting and at least be prepared for your answers. So even if you are nervous, you'll still know what you need to say because you've practiced so much. So make sure that you do practice. A few things to think about. One, you want to try to make it a conversation as much as possible. So the conversations are usually always the best. And what I mean by that is maybe you mentioned that you want to come to this school because you had a research fair here several years ago and you enjoyed it. And so maybe the interviewer will start asking you about that and how he was at the interview fair, and you guys will discuss it back and forth, and that may segue into other topics of conversation. Those are always the best. So if you're able to, try to make it into a conversation. Number 2, try to be personable. Don't just say your answer and then be quiet. Make it, again, more like a conversation. Try to deliver your answer with inflections in your tones, with hand movements, with appropriate body language to engage the interviewer as much as possible. When you are preparing, it's super important to remember, don't just memorize your answer. 1, that's probably going to lead to actual mistakes during the real interview. And number 2, that just becomes unnatural and very, very rehearsed. Try to prepare your answers and have an idea of what you want to say, but don't memorize it line for line. The student interviewer, as we previously mentioned, usually can become a little bit more comfortable than the faculty interviewer, but remember, just remain professional. It can feel like a colleague. They're usually students that are maybe 1 or 2 years ahead of you. It can feel very comfortable, but make sure that you do keep it professional. Don't be rude or inappropriate in any ways. And the faculty interviewer, when you get your actual sheet for the day and your agenda, they'll usually tell you who the faculty member is. And make sure you know your audience a little bit. So let's say you look on your sheet and it shows that your faculty interviewer is an immunology researcher. Maybe it's not going to be the best to talk very much in detail about your clinical research and how you studied the individual mechanisms of some drug and its delivery and half-life to a patient. That person may not be able to follow as well, or maybe not as interested. So make sure you know your audience too and prepare your answers appropriately, or at least think through your answers appropriately for that interviewer. So let's talk about MMI interviews. So MMI interviews are something that were developed about 10-15 years ago, and now about 50% of schools are using MMI interviews. So the MMI interviews consist of multiple small stations where an interviewee goes, gets a small prompt, and then enters a room and begins to deliver that prompt. Let's look a little bit more closely. Most schools have around like 4 to 8 stations, and most of the time you get about a minute or two to read that prompt, and then you go into the room and you discuss that prompt for usually somewhere between 5 to 8 minutes, and that depends on each school. Inside the room is a rater. The rater can be somebody that just sits there and listens and possibly asks you follow-up questions, or the rater could be an actual person who's acting in a role. So let's talk about a few of the different examples. Most of the time, MMI interviews are testing ethical things and decision making, or problem solving. So they're really giving you a scenario to assess all of these different aspects of yourself and how you're able to apply some of these to different cases. Very, very reflective of your time as a physician and how you're going to be able to adapt your delivery and yourself to different patients and different people surrounding you. So for example, let's take a MMI scenario that I see pretty commonly. You're a physician, you have one liver, and you have 2 patients that need a liver donation. One is a 20-year-old mother of one, and another one is a 70-year-old alcoholic. How do you decide who gets a liver, who doesn't? So you read that paper, and then you walk into the room, and you have to just start discussing about it. First thing I recommend is repeat the scenario. You don't need to repeat it word for word, but just at least summarize it. And you can ask the rater in the room, is that correct? And they'll either say yes, or they'll say, no, actually you missed an important point, blah, 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 blah. And actually can give you some feedback if you didn't quite understand the question. And then the next thing to do is just begin discussing it. You can see already how important preparation is for MMI. You really, really need to practice going over several different scenarios and try to organize your logic and organize your response to them. So you have to, of course, focus on all of these things. What are the ethical standards of who to give the liver to? How do you make that decision? And obviously there's this problem here. You only have one liver. What are you going to use to decide who gets that liver? Check out our examples for more information and more delivery on this, and definitely use some interview preparation and talk with advisors and work through these scenarios, because they can be very, very difficult to get started on. And once you actually work through several of them, you can start seeing that there's similar themes and that there are things that you should think about with each MMI prompt. And then as you continue to practice them, then you'll be able to kind of logically organize your response, which is very important as well. So after you've delivered a several minute response, the rater in the room can either just say, okay, or they can ask you a follow-up question, which again, you would then respond to. We recommend that you try practicing to deliver your response somewhere between 3 to 4 minutes. That's a long time just to talk. So you really need to practice it. Even just being able to talk about something for 3 to 4 minutes takes practice. The other type of scenarios that I mentioned are actors. So you actually walk into a room and there's somebody acting out the scenario. So usually this is an upset parent, an angry patient, or even just like a colleague that you have to discuss something with. So one that I see commonly, and as an example from the creators of MMI, is you are on a work trip and you're traveling with your friend, your colleague from work, and she's super scared of flying. Go into the room and start talking to her. And so you may enter the room and the actress could be crying, could be upset, and you have to console her and work through the problem. So definitely need to be prepared for that, because it can be quite tricky. You need to be prepared for somebody sad, somebody angry, somebody quiet, not saying anything, all different types of scenarios. And then lastly, the other types of scenarios I commonly see are a scenario where you read a prompt and it asks you to explain something. So it may explain using only words how to tie a shoe, how to brush your teeth, explain to somebody why the sky is blue. these are kind of just your reasoning, critical thinking skills that you're testing. And so there's no way to prepare for every possible different MMI scenario. But again, when you go through different scenarios, you'll start to see common themes, common threads through them. So it's important just to keep working through those to have an understanding and a foundation for the actual interview day.